We're joined by UKZN Deputy Vice-Chancellor for Research, Professor Mosa Moshabela. Professor Moshabela, good evening to you. Thanks for your time. So we're edging towards midnight. Last I checked, we didn't quite have the regulations that are necessary in place. We're still waiting to hear what exactly is going to happen. What is the sense that you get?
Yeah, greetings, Kathy, and to the viewers. I think it's an important transition tonight. I really think that it was due for us to end the state of disaster. I agree with the decisions that were made. But I think the biggest distinction between those regulations under the Disaster Management Act and the ones that we are expecting under the National Health Act is that the Disaster Management Act was focused solely on COVID-19 regulations. But the regulations that are proposed for the National Health Act amendments, they are more about communicable diseases or notifiable medical conditions. And they are not specifically about COVID-19. And I do think that the public commentary and the comments that were received, 300,000 comments, require a thorough, transparent process for engagement and incorporation. And really, I do think that they should not be rushed. I expect that the Department of Health should put in place a stopgap measure instead of bringing forward, the final draft that then needs to be promulgated or gazetted.
Of course, it was just in the last week or so that the department would have still been taking some of these submissions until the 24th of April. What will happen if, in fact, some of then those final draft regulations are gazetted tonight? What do you think that's going to do, especially in the mind of the public where that issue of transparency is concerned?
Yeah, Kathy, I think that we are in difficult times, and I really expect government to be sensitive to that. There is a climate of mistrust. There is a climate of power contestation, and any process that is less than fully transparent in a way that the public is assured that the inputs that have been put forward have been fully taken into account can actually be detrimental to the cause that the department is embarking on in terms of amending the National Health Act. We saw it with tobacco when there were, I think the minister had said, or Cocter had said, there were 22,000 comments, and really there wasn't really a clear description of a process of taking those comments into account, and in fact it left a lot of people feeling like those comments may have been ignored. And I think in this case, it's really important that there's a clear demonstration of how these comments and submissions have been taken into account to arrive at the next draft that can then be made public and gazetted.
When we look at what has come out of the health department, where, the new set of regulations are concerned, it seems to be much of a continuation from what we had under the national state of disaster. Does it have to be significantly different in order for it to gain legitimacy, Professor Moshabela?
What I see in the draft that has been put forward for public commentary and submissions is a draft that emerged out of the lessons learned from the past 2 years and the process of regulating COVID-19 and really regulating behavior and adherence and compliance under COVID-19 regulations. And I don't necessarily see it as a continuation, because I think that if it was a continuation, it would speak only to COVID-19. But if you look at it, it speaks to different notifiable medical conditions, not even only respiratory conditions. There could be other kinds of notifiable conditions. So I think we have to look at it in that light, that it's perhaps meant to be a process that builds up on the lessons that we have learned rather than continuation. I hope that makes sense. That's the distinction that I make. And that's how I looked at them to say, what is it that we have learned from the past 2 years, and how are we taking those lessons forward going into the next phase of the new normal that we have to be confronted with? We can't go back to where we started, and I think really it's a question of exactly what is it that we are taking along and what is it that we are not, but we cannot necessarily ignore those lessons.
And for those that have looked at it, some of your colleagues, Professor Moshabela, and have critiqued it and have said, you know, some of the regulations, at least what we saw in the draft, were redundant and that they didn't take a full appreciation of the lessons that had been learned.
Yeah, I think that it's also a product of sort of taking lessons without engaging in a thorough process of synthesizing those lessons. I don't think that as a country we have done that yet. I think we have constantly been bombarded with crisis after crisis after crisis. And I can't say, even in the scientific community, I cannot necessarily say that we've really taken the time to draw those lessons. In fact, one of the sort of more comprehensive reports has been the South African Health Review that came out recently that seems to suggest that some people have been thinking about the lessons. So I think that the process of synthesizing those lessons is going to be ongoing, but I don't necessarily think that it's helpful to critique it from outside and say it's redundant and not make submissions on how it can be improved. I think the opportunity to comment and make submissions is a critical step, which is also why I think it's really important that the department takes that step seriously and do it in a way that is thorough and not necessarily rush it. So that would be my view of it. I mean, I've seen some of those, I've seen the drafts, and I think some of them, yes, they actually are progressive, but some of them, in a way, one wonders what is the basis for them. And in those cases, I think it's also fair to explain the rationale to the public without necessarily sounding paternalistic in our new regulations.